Eplerenone is used alone or in combination with other medications to treat high blood pressure. Eplerenone is in a class of medications called mineral corticosteroid receptor antagonists. It works by blocking the action of aldosterone, a natural substance in the body that raises blood pressure. High blood pressure is a common condition and when not treated can cause damage to the brain, heart, blood vessels, kidney and other parts of the body. Damage to these organs may cause heart disease, heart attack, heart failure, stroke, kidney failure, loss of vision and other problems. In addition to taking medication, making lifestyle changes may also help to control your blood pressure. These changes include eating a diet that is low in fat and salt, maintaining a healthy weight, exercising at least 30 minutes most days, not smoking and using alcohol in moderation. Indications. Eplerenone is used to treat your heart failure, to prevent worsening and reduce hospitalization if you have had a recent heart attack in combination with other drugs that are used to treat your heart failure, or have persistent mild symptoms despite the treatment you have been receiving so far. How to use. Always take this medicine exactly as your doctor pharmacist has told you. Check with your doctor pharmacist if you are not sure. Eplerenone tablets may be taken together with food or on empty stomach, swallow the tablets well with plenty of water. Eplerenone is usually administered together with other medication for heart failure or beta blockers. The usual starting dose is 1 25 mg tablet once daily, increasing after about 4 weeks to 50 mg once daily. Either as 1 50 mg tablet or 2 25 mg tablets. The maximum dose regimen is 50 mg daily. Blood potassium levels should be measured before starting eplerenone therapy within the first week and 1 month after the start of treatment or after changing dose. The dose may be adjusted by a doctor depending on the potassium levels in your blood. If you have mild kidney disease, you should start on 1 25 mg tablet every day. And if you have moderate kidney disease, you should start on 1 25 mg tablet every other day. These doses may be adjusted if your doctor recommends and according to your blood potassium levels. In patients with severe kidney disease, eplerenone is not recommended. In patients with mild to moderate liver disease, no adjustment of the starting dose is required. If you have liver or kidney problems, you may need more frequent testing of your blood potassium levels. For the elderly, no adjustment of the starting dose is required. For children and adolescents, eplerenone is not recommended. Contraindications. If you are allergic to eplerenone or any of the other ingredients of this medicine, if you have high levels of potassium in your blood, hyperkalemia, if you are taking groups of drugs which help to excrete excessive blood fluid, potassium-sparing diuretics, if you have severe kidney disease, if you have severe liver disease, if you are taking medicines that are used to treat fungal infection, ketoconazole or itraconazole, if you are taking antiviral medication for treating HIV, nalfenavir or ritonavir, if you are taking antibiotics used to treat bacterial infections, clarithromycin or teliflormycin, if you are taking nifadazone used to treat depression, if you are taking medicines used to treat certain heart conditions or hypertension, so-called angiotensin converting enzyme inhibitor and an angiotensin receptor blocker together. Warnings. You may not be able to take eplerenone if you have severe kidney disease, high potassium levels in your blood, or type 2 diabetes with increased levels of albumin, a protein in your urine. Tell doctor about all your current medicines and any you start or stop using. Many drugs can interact and some drugs should not be used together. Don't use potassium supplements or salt substitutes unless your doctor has told you to. Side effects. Get emergency medical help if you have signs of an allergic reaction, hives, severe stomach pain, difficulty breathing, swelling of a face, lips, tongue, or throat. Eplerenone may cause serious side effects. Call doctor at once if you have a lightheaded feeling, like you might pass out, diarrhea, vomiting, little or no urination, fast or irregular heartbeats, trouble breathing, swelling in your feet or lower legs, or high potassium, nausea, weakness, tingling feeling, chest pain, irregular heartbeats, loss of movement. Common side effects of eplerenone may include high potassium, headache, or dizziness.